Good evening. On March 13th, 2020, I, Clint, Parish President of Ascension Parish, filed an emergency declaration for Ascension Parish. The Emergency Operations Center has been activated since Friday, and I have activated select emergency support functions to assist our staff in the OEC. It is unfortunate to have to announce that it has been confirmed, per the Governor's press conference, that a resident of Ascension Parish has tested positive for the coronavirus. We are monitoring the situation and will keep everyone informed. At this point, the number one priority is to protect the health, safety, and welfare of the public. It is crucial to keep critical government functions fully operational. We ask all the parish employees to check their text messages and emails throughout the day and every day. This is a fluid situation, and we are developing multiple plans depending on various scenarios. We are working closely with our OEP, the Sheriff's Department, and our municipalities, and mostly important, our medical professionals. Because this is a medical emergency, I am not in a position to argue. To the best of my knowledge in listening to our medical professionals, the best things to do is to flatten the curve in order to prevent a massive depletion of the current capacity of our medical facilities. We have some of our medical experts here today, Dr. Fraiche, Dr. Trevino, to talk a little bit about the COVID-19 virus and good habits to prevent the spread of the virus. We will hear from our Ascension Parish Councilwoman Terry Casso, our sheriff, the mayors of our municipalities, and we will conclude with our medical experts who will be available to answer questions. Terry?
Thank you very much, Clint. Briefly, on behalf of the Parish Council, I want to thank this administration for its rapid response to our public health emergency. Our medical community, we owe them a debt of gratitude for quickly responding to us to answer all of our questions. So Dr. Fraiche and Dr. Trevino, we appreciate you very much. And I have nothing else to add, so I will get out of the way and let those who have more to offer to you speak to you. The only thing I will ask you to do is I implore you, follow the guidelines. Do what you are asked to do in order to protect your health and the health of your loved ones. Thank you.
Bobby Webre, the Sheriff of Ascension Parish. I too want to personally thank the Parish President, Clint, and all of the members of the OEP staff for setting up a unified command last Friday. A lot of information has been received, a lot of information has been passed on to all the players in the parish and the broader community, and it was what needed to be done, and it was done in a timely manner. Also want to thank Dr. John Fraiche and Dr. Chris Trevino for being available to us with their busy schedule. As you can imagine, they have always been available to us since this crisis started to unfold. From a purely law enforcement standpoint, I will tell you we know that our mission is to protect and to serve. That is a vital mission that we have to do on a 24/7 basis. We know we have to perform. Now, how do we do that with a crisis of this nature? We have to protect our workforce. So as you know, our vital functions is corrections, our jails, our dispatch, and certainly our enforcement personnel. We have to keep them healthy to do their job. And we do that in many ways. One, to make sure they have the right equipment, make sure they have the right supplies, and make sure that they are following the guidelines and the rules that are put out by the CDC and by the Louisiana Department of Health. We're following all those rules that they're putting out. The jail is a enclosed population there of over 500, so we have to take special precautions there. As you know, earlier this week, we canceled all visitation at the jail. We canceled religious services at the jail, and we canceled anyone from being able to go into the jail except vital vendors to supply that jail. All court has been canceled, but court is being done from video conferencing, so there's still court cases being heard, but it's being handled by court call and video conferencing. As far as the declarations that Governor Edwards put out, we will be paying close attention to that. You know, it's a fluid situation. Our patrolmen will be out in force, and as time passes, if this condition worsens in Ascension Parish, we will double up our forces. We will handle this not so much unsimilar to maybe a hurricane. We will go into a condition Bravo where we may double up some of our forces. But we'll be ready, and we know we will get through this as we got through all of our crises. And I'm looking forward to working with Clint and his administration and the medical profession to see where we go on a daily basis. I know we have our next meeting at 6 p.m. tonight. I want the citizens of Ascension Parish to know that law enforcement, all of your first responders are ready to go. We can handle this, and we'll get through it as well as we got through other crises in our history. So thank you. Barney?
Thank you, Sheriff. Barney Arceneaux, Mayor for the City of Gonzales. Ladies and gentlemen, it is time to take this very serious. It wasn't very long ago we heard about this starting up in China. Some of us were all saying it'll never come here. Well, folks, it's here. So it's very, very important to all of you to take it very serious at this time. Now, what I'd like to do is just tell you a little bit about City Hall, what we're doing in Gonzales. We are operating. City Hall is open. It is open for folks to come through our line on a side window. We'll conduct business there. We do not want folks coming in to City Hall. We have to protect our own employees. But we will operate. We will conduct business. Right now, anything that's that was taking place at the Civic Center, at the City Room, all the rentals there, we have shut that down until further notice. Again, follow the guidelines. You have some professional doctors that are here today. They're going to talk to you a little bit more about what's taking place. But I want to say this. All the group that you're seeing here, we're all unified. We're all working together for you, all of our citizens. Thank you very much. Mayor Leroy.
Good afternoon. As the mayor for the city of Donaldsonville, my name is Leroy Sullivan, and I just want to say to the community of Donaldsonville, West Ascension, and Ascension Parish in its entirety that I'm very grateful for the Office of Emergency Preparedness that we have and the job that they have been doing in order to keep us informed. Thanks to Dr. Fraiche and Dr. Trevino for an excellent job of telling us about the medical conditions that we can expect and what we should do in order to keep our communities safe. We've heard a lot from the President of the United States. We've heard a lot from Governor John Bell Edwards, and I just want to encourage each and every individual that we have to work together. Things are going to be a little bit uncomfortable because you may not have all of the services that you need, but be patient. One of the key things that I've learned through this ordeal thus far is that not panic, but we all need to be very cautious of the things that we do, the places that we go, and people that we let come in close contact with us. So again, the city of Donaldsonville, the City Hall will be open, and we will make some adjustments in order to make sure that we can serve the people of our community in a safe way. Thank you, and God bless you.
Mike Lambert, Mayor of the town of Sorrento. First of all, I would like to I'm not going to echo what the professionals and our fellow elected officials have said, but the town of Sorrento is operating as normal. We have done some restrictions to our building to protect our employees. We are asking all of the persons who come to the City Hall to conduct business, we'll do it through a drive-up window, and just to protect our employees. Our employees also are being screened daily on a question screen, so we will monitor their health on a daily basis. And our community center, all activities have been canceled through April the 13th, and we'll be working with our medical professionals to provide what services as needed or requested. So that's what we're doing in Sorrento, and I appreciate it. Thank you.
Hi, I'm Chris Trevino. I work at St. Elizabeth Hospital. I'm an emergency room physician. I'm also the administrator and the CMO at the facility. First of all, let's just talk about the facility. We are 100% open and ready to take care of whatever medical needs hits our community. That includes this onslaught of this virus. All the efforts about isolating and about securing your loved ones, especially those that are at most risk, is about trying to slow the spread of this virus. We know the virus has arrived. We know it's going to sort of make its way through our nation. But the speed at which it goes through our nation is critical. It's critical to understand how that will impact the community. If the hospitals and our medical community gets inundated, then we lose the ability to respond. So what we're asking and employing upon everybody is to listen to all of the advice about isolating yourselves, social isolation, particularly those who are at greatest risk, so that we have time. It wasn't that long ago that we had a pretty significant flood here in our parish, and that flood was a result of too much rain. And this is in an area that we get rain all the time. So even an area that gets rain all the time can get too much, and when it does, the result was a flood. So I liken that to what could happen with COVID if we're not careful. And that is to say, we are prepared and able to manage illnesses and disease on a regular basis. But should it come too fast and too much, it would overwhelm us. Unlike the flood, where we have no ability to impact how much rain is coming out of the sky, we do have the ability to impact the number of sick people that hit our community. And the way that we do that is by following the instructions that we've been given by our state and local officials as far as isolating ourselves and to try to slow the spread of this disease. We will be having a testing center in the parish shortly. I can't give you an exact time, but we certainly hope within the next few days to be able to establish that, and that information will be made available once that has been made available to me. Again, the hospital is open and ready. I do not want you to fear that we are not capable or ready to manage all of your medical illness or concerns. The other hospitals in the Baton Rouge market are also open and are quite capable, and we have a very robust healthcare community in the Baton Rouge greater market. So I don't want you to fear all of that, and we will absolutely get through this. How we behave and how we monitor and how we take care of ourselves will impact the degree at which this has a negative impact on us.
Thanks, Chris. That's very helpful information. Chris talked about flattening the curve, and I'm going to talk a little bit about ways we can do that. Many people at this time of the year already have cough, congestion, allergies, sinus problems, maybe fever. We still have a very prominent flu endemic in our communities. We're seeing people with influenza every day. It's hard to differentiate influenza possibly from COVID-19. So ways that we can have an impact are everything you've heard on the news programs. Cover your cough, wash your hands, use hand sanitizers, try to avoid crowds, social distancing. I mean, every day we hear a new limit on the number of people that like to have gathered together, and that keeps dropping as we speak. The governor gave some great thoughts today. I know that we live in a parish that our leaders work very well together, and Ascension always responds well to any disaster that we have. This disaster is a little more difficult. It's invisible. If we do what we're supposed to do, and particularly social distancing and working with your providers, I think we can get through this. Hopefully we can get through it without a great deal of difficulty and without significant loss of life. Things that we can do as patients, as providers, as individual citizens in our community. One thing is, if you feel sick, don't go to the emergency room initially. Don't go to urgent care. Don't go to your doctor's office, because if you would have COVID-19, you can spread that. We are really encouraging patients to contact their physician by other media. If you can do a video visit with your doctor, that's great. If that's not a possibility, then call your physician's office. Don't show up with cough, congestion, or fever without at least having an initial contact. Many of the systems in our area can do video visits. That's probably the best type of visit at this point in time. No one's worried about the payer on these visits, who's going to cover them. We just want to take care of the citizenry and decrease the amount of mortality and morbidity we may have. In addition to contacting your physician, by immediate, if you go to someone's office to be seen, if you feel that sick, or you have a child or a parent that's sick, as you go to that office, before you see the physician, let them know if you have cough and fever, so they can put a mask on you, so they can isolate you from the other patients that may be in those offices, clinics, or emergency rooms to keep from spreading this virus. The longer it takes for this virus to be spread through our community, the more likely it is we have enough resources to do everything we need to care for our population. One thing that Dr. Trevino alluded to, in this greater Baton Rouge market, all the healthcare systems are working together. The Lake, the Baton Rouge General, Ascension, Baton Rouge Clinic, urgent care centers, we're working together to such an extent that today we opened a testing center on the old Baton Rouge Bluebonnet campus that all of the systems are helping man. We had, I think, 186 tests done at the testing center today between 1 and 3 o'clock this afternoon. We had 12 people turned away. We're not asking people to go get tested. You cannot be tested without having an order from a provider. We know that if all of us could be tested and we had the opportunity to be tested and we had the testing capabilities, we'd all probably want to be tested. Unfortunately, we don't have those resources at this point in time. Every day we seem to be getting more resources to test, but part of the reason we have so few cases determined right now is we've had only about 400 people tested and the test confirmations that have been returned. So the best way to get care if you feel you need it is contact your provider. If you don't have a provider, the state has a general number. It's 211 to help get information on questions about COVID and maybe helping you to find a provider. Insurance and cost is probably not an issue right now. Most of the payers have waived a lot of these costs. The president said we're going to treat all comers with this disease and try to test people who need to be tested. Not everyone in the country is going to be tested, but we are going to try to test the people who seem to have the need to be tested, who've had exposures, and who symptomatically meet the criteria. If we keep doing this, we can hopefully avoid those who have chronic illness from being exposed to the disease. And when we talk about, other comorbid conditions, we're talking about the elderly. The death rate for this seems to increase by each decade after the 60s. So if we can keep our elderly relatives, friends, and citizens from being exposed, we may decrease the mortality. Other comorbid conditions that we really worry about, people with chronic lung disease, people with chronic heart disease and congestive heart failure, diabetics, and people who may have malignant disease that are receiving immunosuppressive therapy. If you have any of those members in your family, all those comorbid conditions in your family or friends, really try to isolate them from being exposed to the disease, even more so than our younger population. Most of you are aware of 80% or so of the people that get this virus have minimal symptoms. It's those that really have comorbid conditions and the elderly who are at most risk for this, and so we're really trying to help those individuals prevent from having to deal with some of the severity that can come from this disease. Thank you.
At this time, we'll take a few questions. So please, if we can do this in somewhat of an orderly fashion. If you have any questions for our medical experts, we'll take one at a time.
So we have a ICU capacity of about 7 beds. We don't anticipate any issue with that at this time. We have the ability to probably expand our critical care needs to probably 10, if I include some of the critical care beds in the emergency department. More importantly, though, we're extremely well connected to our healthcare facilities in the Baton Rouge market, and they have a much larger number of ICU beds in that market. So right now, I speak of just in this parish at St. Elizabeth. But like I said, it is common for us to move patients up the road, if you will, as the need arises. Actually not. I think our public has been very attentive to the information that's coming from our officials. Actually, our ER volume for the past few days is down, and we actually see this in other parts of the country, people simply staying home, which is very, very good. At the hospital itself, unfortunately, we are restricting access for visitors. So I apologize for those that are trying to get to their families to want to visit with them while they're being treated in the facility, but for their safety and the safety of everyone in the facility, we're restricting access. So when you arrive to St. Elizabeth at this time, you will see that there will be someone that will greet you, and there will be a screening process, and there will be limitations as to what we're allowed to do, or what you're allowed to do in terms of visiting. We are involved in the testing center, and will be established on the campus. So we're in the process of getting that stood up at St. Elizabeth, yes. So, so otherwise than that, than planning and meeting with local and state officials in preparation and getting education out, it's pretty much business as usual. Correct.
Yes.
We don't know yet. Still, yeah. So working with the Homeland Security Office here in Ascension Parish, we always run the contingency to its nth degree, and they are actively looking at what would it look like to have an alternative care site, how would we staff it, what are the wraparound services that would be necessary to maintain it. So those are great questions. The answers are sometimes difficult, but we're kind of used to doing sheltering from storms, so we have some practice in this. But the source that's causing our threat is a new one. So our response has to be a little tailored to that.
We really don't have that information. He still has his own personal health privacy. So I don't know how much of that information we'll get from the state or otherwise. Unfortunately, we get more information when someone has died because their HIPAA rights kind of go away some with death. So I don't know. I wish I could tell you. I think all of us would love to have that information, but we really don't have it at this point in time. And I just want to go back to your question about ICU care. The Baton Rouge Market has a number of ICU beds. I mean, I think the lake alone probably has close to 80 when you add all the ICU units together. Plus, they have a heart and vascular tower, which can be turned into ICU beds. The General and Ochsner have a number of ICU beds, Lane Memorial. The problem is not going to be ICU beds. The problem will probably be respirators, ventilators, having enough ventilators, because not everybody in ICU is ordinarily on the ventilator. This could really pose a ventilator crisis, and having enough, personnel, intensivists and hospitalists to take care of these people. I think that's where our real challenges are going to come in, and we would hope that, again, if we can flatten this curve, we won't be overwhelmed at any particular time. People and enough of the machines to allow us to have people on ventilators or respirators to handle the problem. It's again getting people in the smaller groups, keeping them at home, isolating people who may have the illness, and not letting someone who may not be very symptomatic but is carrying that virus and exposing other people who may not have the same immune system and may not have the same capability just to brush this off.
Just to answer that question just a little bit further, we know from the data that isolation has a profound effect on the speed. None of this makes this go away, but it will dramatically slow down the rate at which spread occurs, and therefore it dramatically improves our ability to respond, which is why I think the message is so important to do the best you can to isolate yourselves, social distancing, particularly those at the greatest risk, and then we will find ourselves in a much better position weeks and months ahead.
Yeah, we're following the lead from President Trump as well as our Governor, John Bel Edwards, in initiating a size limit on gatherings, just trying to limit the spread. So, we have medical professionals from the federal level to the state level to the local level, and they're all telling us the same thing. So it's very important for us to listen. There's no confusion in the message. It's clear, it's defined, and so, what we're doing is we're urging the public to listen, and please be vigilant. Yep. Our OEP director, Rachel Wilkinson, has been in constant contact with our plants and other businesses, and so we're trying to establish policies, and we're working with them on a daily basis. So we're in constant contact with them. Each one's a little bit different, but communication is key. It's so, sure.
We had a conference call today at 11. We're going to continue those throughout the week. Each facility is different. Their need is different. They're also following the CDC guidelines, the guidelines through the state in coordination through our office and through our care organization. Each of them is looking at the size of their facility. Employees, obviously, they have different needs. A lot of them have shared shift changes or scheduling changes. Each facility is different, though. But they're in constant contact with our office, and we do conference calls daily. I mean, the chemical industry they don't want to shut down either, and so staffing is a top priority right now. So cutting staff is looking at schedules. That's just kind of the approach that they're taking right now, but no impact to facilities. We confirmed that today.
Yeah, absolutely. The key is to keeping our staff safe in order for us to provide critical, essential functions to the public. So we're taking steps in order to protect our staff. But everybody will continue to receive a check. This is and work. People that are at risk, we may have them stay home. Anybody that may be having any type of symptoms, just as a precautionary measure, we're asking them to go home, check their temperature. If they have a temperature, we're asking them to go see a doctor, get checked out. And this is just to protect our staff so that we can continue to provide the essential services that we do to the public.
I think we're all a little more somber this afternoon now that we've had one case from Ascension that's been diagnosed. We have numbers of people at home who are in quarantine. We have people who've been tested. We're going to have more cases, but hopefully, yes. And all of us have had to deal with people who've been in Europe who come back, and we have to have them in self-quarantine. So there are a number of other people that are under observation, and none of these people may have the disease, but certainly others will. And so I think it's hard when you have the first case. I think yesterday we talked about it. We felt very fortunate we hadn't. But again, now that we're testing more people, we're going to have more cases. And so I think and part of the problem is that the testing, it's not a point-of-care test where you get a result like you do with the flu vaccine. I mean, we've had people tested at the end of last week, and we still don't have an answer on. And those people are, if they're not sick, just had significant risk, they're still in self-quarantine. And we have other people that may even be in the hospitals elsewhere who've been tested from, I don't know where they're from. It could be from Ascension if they're in the Baton Rouge Hospital or New Orleans Hospital. But we really just don't have the answer yet. So More to come every day. Sure. Okay. I just know we have one person. I really don't know any more than that. Yeah, nothing.
Just a correction, we don't have any information that they died. We just know we had a positive
One
test.
case, yeah.
So we don't know
No.
their condition. Yeah, it'll be on our campus, so we'll have signage and whatnot that just gives direction for folks to come through. Again, it'll be another day or two for us to get that set up. I'm still waiting for some supplies and whatnot, but operationally, we're really ready. As soon as we get the supplies and equipment, we'll be good to go. I would expect by the end of the week, we should have something to announce.
And again, it's going to be a testing center that requires a doctor's order to be tested. We've already been testing at our parish facility at Prevost. They've had a couple of tests. They had direct access to LabCorp. They had some ability to test, so they've already tested a few people. I've been communicating with Vince Cataldo, who over at Prevost, since yesterday. We've talked to each other a number of times. Now, again, that testing is limited. They only had the ability to test 20 people. And hopefully, within the next few days, all of us are going to have more testing medium and be able to test a lot more people than we've been able to test thus far.
I want to close speaking directly to our citizens. It is not time to panic. This is a time to stay calm, plan, and to exercise good habits to avoid coming in contact or spreading COVID-19. We will follow up with social media posts, Channel 21 TV, and future press conferences. We are encouraging all residents to sign up for the Ascension Parish Community Alert System, Everbridge. Should information related to local government response need to be shared, we will use our community alerting system. As always, stay informed, and God bless. Thank you.